Good morning and welcome to Health Talk here on AM 1270 and 96.5 FM KXBX. Paul Thomas and Bill Kearney in the studio on a pretty Wednesday as the the smoke seems to kind of have died down a little bit, the air quality getting a little better, and of course with the forecasted rain tomorrow, that should wash a lot of that out of the area.
Is that for real? That rain?
That's
forecast?
what they say. I don't know. You know how you want to interpret that. At first, I saw that we were gonna do like a quarter-inch of rain, and then I think when I was watching it last night, it was down to like a tenth of an inch of rain. So you never know.
Yeah, I was. When I'm giving flu shots now, I'm telling people. I said, They figure these flu strains out a year ahead of time, and I said, we can't even forecast the weather 24 hours ahead of time, so I'm not sure about the effectiveness of the flu vaccine. But, yeah, it's good to be here. Yesterday when I went home from work, it was a little smoky again.
Still was, yeah.
I still have employees that were affected by the fire, and I was just reading this morning in the Press-Democrat that about 30 of the doctors from Sutter and Santa Rosa have lost their homes.
That's what I saw too, yeah.
Our friend, the pharmacist down at Tuttle Drug in Sebastopol or that area has been working 72 hours straight to try to get medication for those people, and we have been providing over-the-counter medications through Dr. Paula Donda to go to the recovery centers, and it's been very well appreciated. So. A really tragic time for people. Santa Rosa High School, I think they had 60 students that lost their homes, and
wow.
I just can't imagine. It's bad enough as an adult, and most of the people that lost their lives were elderly that just couldn't get out. And we are doing everything we can locally, and have gone through that 2 years ago, and then we went through it again at the Sulphur Creek fire. This year, a lot of people that are friends of mine have lost their homes in that fire. And my bookkeeper, who lives in Redwood Valley, had lost her barn and her storage shed, and it went right up to the porch of her house. Just bought the house. Her and her fiance are getting married next spring, and at least she said the smoke smells really bad, and she drives from Redwood Valley to work, and by the time she gets home, it's almost dark again, so I'm trying to let her off early. They don't have any power, any water, anything like that, but their home is still in place. Well, we're going to be talking about your health, and this has been a crazy week to have news about pharmaceuticals, and I have changed my agenda 2 or 3 times because of things that I've just pulled off the internet, and then lo and behold, Sunday night on 60 Minutes, a huge presentation about the opioid crisis and how the people from the DEA that were whistleblowers had really decided that they were sick and tired of being hounded for this opioid crisis, and the people that were in the field that were trying to prevent the medication, the opiates, from being shipped from the wholesalers were trying to, they were go out into these pill factories to try to stop the opioid crisis, and West Virginia was one of the small areas that they talked about, and they would write reports and write reports and write reports, and the DEA people in the field were going after the distributors, which was Amerisource, Cardinal, and McKesson, and we have dealt in the past with all 3 of those distributors, and we felt the pinch, but we were very studious in tracing those prescriptions to make sure that that we didn't over-dispense. However, we had physicians that were over-prescribing, and we would try to document that. Well, as the DEA people in the field found out that the attorneys for the DEA were not doing anything to force the distribution of those drugs to be required to be under a structure, so they would know if they were shipping too much of those items to pharmacies. And a lot of those pharmacies were just pill mills that were giving opiates out for anybody that the doctor would write him for, and some of the pharmacists were in cahoots with the physicians. So in order to deter that, the Congress, one of the guys, I think Marino was his name, that was trying to get a new bill that would keep them from applying some of these jurisdictions to the distributors. And they passed the bill, and that allowed there to be no teeth in the law that was passed prior to that that would make the distributors responsible. So, and the reason this has become such a crisis is because in the past decade, 188,000 people have died from opiate overdoses from '99 to 2015, and they wanted to prevent reckless doctors and businesses from making an already troubling problem worse. And their investigators initiated more than 10,000 cases and averaged more than 2,000 arrests a year. But one of the President's and the Attorney General's highest priorities was to end the devastating and unacceptable drug crisis. But the 60 Minutes report detailed that the DEA efforts may have been undermined by the so-called revolving door. So what happened was at least 46 investigators, attorneys, and supervisors from the DEA, including 32 directly from the division that regulates the drug industry, have been hired by the pharmaceutical industry since the scrutiny on the distributors began. And one of those was Lyndon Barber, which was the chief counsel at the DEA. He's now a senior vice president at Cardinal Health, one of the nation's top distributors. I was just talking last night to a friend of mine, a college friend that lives in Sacramento, and he had sold his pharmacy, but his main distributor was Cardinal Health. And you wonder, did the government and drug industry fuel the opioid epidemic? And Mike Gill, who was the chief of staff and a former DEA administrator, was hired by one of the country's largest law firms, and most recently, a senior DEA attorney overseeing enforcement joined a high-powered pharmaceutical division of that law firm. So the CBS News reached out to Chuck Rosenberg, who saw the agency from 2015 until earlier this month when he stepped down, but he doesn't intend to do anything about this. Well, one of the people that the president was going to hire as the drug czar, I think his name was Marino, and don't quote me on this, but he has withdrawn from being considered for that office and that position. So we have, his name was Tom Marino. He's a Pennsylvania Republican, and he withdrew yesterday from being included. The new law made it virtually impossible for the DEA to freeze narcotic shipments from the companies, according to the Internal Agency and the DOJ. Political actions committees representing the pharmaceutical industry contributed at least $1.5 million to 23 lawmakers who sponsored or co-sponsored 4 versions of that bill, including $100,000 to Marino and $177,000 to Hatch of Utah. So overall, the drug industry spent $106 million lobbying Congress on this bill. The problem is with pharmacy, if we fill these prescriptions and we do it knowingly and even check with the physician, and the physician says it's justified, we're still, if the DEA pulls the doctor down, then we are pulled down with the physician because we filled his prescription, even though the fact that we have documentation that we called the physician, asked for the diagnosis, asked if the prescription was legitimate. If it was early, we let the physician know that we wouldn't fill it early. And it has just gone on to be a very serious problem in enforcement. Now that we are seeing a lot of this take place, and there is a movement in Congress to repeal that bill. I would assume that it will go through rapidly. It was one of those bills that went through committee, went through the Department of Justice, went through the DEA, went through all the agencies that were supposed to do a checklist on whether this bill was a good bill or not. And because it just went through the committees and there was no negative comment about it, it didn't even go for a full vote. It was just accepted and passed through Congress without individual voting. And that happens typically when there aren't any appeals or any conflicts that are addressed at the time the bill is being passed. Now, I'm not a politician. I can't tell you what was going on or how it went on, but I have heard those things through the media, and whether I can trust the media or not is something else. So I just want to let you know, if you watch 60 Minutes, that that is a real problem. It just gives me a lot more lack of faith in our legislative system, in all of our government systems, to know that, and look, it shouldn't be any surprise for you to understand that politicians are getting paid off. It happens all the time. As much as you don't expect it, it happens at the lowest of levels and the highest of levels. So again, this government was created by the people for the people, and it's become a government by the politicians for the politicians. And when we have 200,000 lives that are claimed, that's more than 3 times the U.S. military deaths in the Vietnam War. It doesn't appear that there's any end in sight. A handful of members of Congress have allied with the nation's major drug distributors, and you know, I work very close with the drug distributors, and I'm on a board of directors, or was until I resigned recently, that one of those distributors is a part of our organization, and I'm no longer a board member, a national board member for that organization. That has little to do with this issue, but it's happening all through the industry. I used to be so proud of the pharmaceutical industry about how ethical they were. Now I'm no longer proud of them. And while I'm going on about the healthcare industry, and I just saw this article this morning, and it's not news to me, but I'm sure because of Medicare D, October 15th, which was a couple of days ago, was the beginning of the enrollment for Medicare D plans, and that goes on until December 7th. So I started researching a couple of weeks ago on some of the Medicare D plans. And an article came out this morning that says, could your health insurance be costing you money at the pharmacy? And there was an example of a patient that was a 46-year-old firefighter from Phoenix. He got an antibiotic from his usual pharmacy through Cigna Health Insurance. When he got home, he told his wife he paid $71 for a 15-day supply of doxycycline, which is an antibiotic that's quite specific, that's been on the market for a long time. Its price has inflated considerably, but he thought the price sounded high. Later, the couple realized that he'd been charged double what he would have been paid if he'd hadn't used his insurance. Excuse me. He realized he'd been taken advantage of, and this happens all the time. He was charged a copay that actually was more expensive than the pharmacy's cash price for the prescription. And that's what we call a clawback. And the drug companies are doing that. And just to put it in perspective, the clawback for one of my stores last month, just the month of September, well, or the month before that, I don't have the figures in for the month of September, was $7,000 in one store, $6,000 in another store, and that was just for 1 month. Now, this is after we've put the prescriptions in the computer, filled the prescriptions, got the payback on the prescription, telling us how much they were going to pay us. And after they told us they were going to pay us this much, they took $7,000 away from us, $13,000 away from Northlake Medical Pharmacy just in 1 month, after we reconciled the claims. And one reason are these clawbacks, and you've heard me talk about PBMs. It's a middleman called a pharmacy benefit managers. They handle the prescription drug part of your health insurance plan. So you have Cigna, if you have Humana, if you have Aetna, any of those companies, they have a PBM. For patients on certain insurance plans buying more specifically generic drugs, the benefit manager may charge a copay that exceeds the drug's cash price. And we have lost more than $1,000 on some of the specialty prescriptions. When that benefit manager charges the higher price and then pockets a portion of the copay, that's a clawback. Those clawbacks are DIR fees that were supposed to be directed back to you as a patient and us as a provider. But many Americans are paying extra for some of the most commonly prescribed drugs in the country, and you are a victim and we are a victim. Consumers rarely hear about clawbacks, but pharmacists around the country told NBC News because of their so-called gag clauses in their contracts, they often prevent them from discussing the practice with customers. Part of the contracts we sign with PBMs prohibit the pharmacist from being able to share that information, that possibly a medication would be less expensive. And if we do tell you as a customer, as a patient, we could lose our contract. We're not doing that. We're taking the risks. We're here to take care of our patients. It's extremely hard to see patients paying more for a prescription than they normally have. One of the things that will help is if you ask us if you're paying more than you would pay as a cash price. We have a Good Neighbor Pharmacy plan that is like Walmart, like Kmart, who used to be, which I want to remind you that their pharmacy is going out of business as of this week, I think. And although their files have gone to CVS, we can fill any prescription for you. You do not have to go to CVS. God forbid if you feel like you do. If you want a independent pharmacy and a family-owned pharmacy to take care of your prescriptions, they should not cost you any more than they cost you at Kmart. And if you do have to pay a cash price, CVS is probably the highest cash price pharmacy in Lake County. So we are willing to go on the record about clawbacks, and other pharmacists that were interviewed by NBC News said they've encountered clawbacks and gag clauses, and they were afraid to be identified because they believe it puts them at risk of being dropped from the insurance plans. Now, I hope I don't get on the air 30 days from now and tell you that I no longer can fill your prescriptions because I'm talking about these, but many customers, especially those with high deductible insurance plans, can be costly. I had a lady in this week, a patient, and she was getting an eye drop, a very expensive eye drop, and the first time she paid for it because she had a high deductible, it was $400. And she asked me that question. I was giving her an immunization, and she said, do I pay more for that? Would it be cheaper if I got it just off your plan? And it ended up that the prescription cost us $197, and she was paying $56 for a copay. So the chances are that the insurance company was less because if it cost us $200 and she was paying $56, which was a low percentage and a quarter of our cost, that it was a better deal for her to go through her insurance companies, but that isn't always the case. The very first time she got it, it was $400. One customer paid $43 for Simvastatin, and the generic price would have been, without insurance, $19. Another customer had a copay of $58 for an antidepressant. The cash price was $33. A different pharmacist shared the example of a customer whose copay was $129 for an anti-nausea drug. The cash price was $18. A third pharmacy, there was $117 difference between the copay and the cash price for allergy and asthma prevention. They're typically taken on generic drugs, and they affect a wide range of medications for diabetes, blood pressure, cholesterol, depression, anxiety. The clawbacks are even bigger than the difference between the copay and the cash price, meaning they cost us the money as well. Doug Hoey, who is quoted in this article, who's a personal friend of mine, and he's the executive secretary of the National Community Pharmacists Association, represents 22,000 of our pharmacies, said the practice is a relatively new one. It came in the Obama Medicare ruling. It was not meant to be expensive for you or not to cost us. The high deductible health plans where more of the cost is shifted to the consumer. And we've been put in a position to pay those inflated copays at a different level as well as you. 83% of the 640 pharmacists that they surveyed had at least 10 copay clawbacks in the previous month. I can tell you mine are pages and pages every month. They don't happen on all plans or even all those with high deductibles, and it seems to occur most frequently with the third biggest pharmacy benefit manager, and that's Optum Rx. And they serve more than 20% of the market. I can tell you I was just audited by Optum Rx. They told us that we owed them over $4,000 because we put a day's supply was 31 days, and we put 30 days for a day's supply. They're taking back all that money. The nation's two largest pharmacy benefit managers, Express Scripts and CVS Caremark, said they don't engage in those plans, but I'm telling you they do. And they said that they don't prohibit the pharmacists from talking about them. You know, we're reviewing Medicare D plans now, and I started yesterday. And along with the costs of what it would cost you to come to our pharmacy, and it zeroes in on your number for your code for your mailing code. It narrows it into however many zip codes you want to put in there. Then it will give you the price it would cost you at our pharmacy, and if we put our pharmacy in there, and what it would cost you to go mail order. It's slightly less to go mail order, but if you take the number of prescriptions that you take and see what the annual difference is between coming to a local pharmacy and going mail order, it's less than a couple of $100 usually on most plans. The people that were using Optum Rx claim the pharmacy benefit managers took part in a clawback, and they are suing Optum Rx. Optum Rx says our role is to improve prescription drug access and affordability for the people by negotiating aggressively with pharmacies and pharmacy manufacturers. I'm telling you, I've never talked to Optum Rx about anything but screwing us. So, and I'm sorry that I'm so blunt about that word, but that's exactly what's happening. They declined to give an on-the-record comment about allegations that it contract prohibits pharmacists from telling customers when a copay is more expensive. Some states are taking action. Texas legislature earlier this year felt like an unwilling accomplice to deliver profiteering, and so they outlawed. They're making pharmacists and pharmacies look bad, charging more than they should. So the new Texas law became one of 11 states to outlaw the clawbacks, and the health insurance plans can't require members to pay more for a drug than they would if they paid without insurance. So again, it's asking us to be more diligent. What I said to you starting a year ago was be surprised you have to be your own health care provider. There's a bill in Connecticut that does the same thing. You don't have to be a drug expert to see there's only, let's see, 1, 2, 3, 4, 5, 6, 7, 8 states, 9 states that ban clawbacks. Every other state, including this wonderful state of California that takes every opportunity to gouge you one way or the other, are going after more and more of your money. So ask about clawbacks, ask about the price of drugs, ask about if they could be more competitive by paying it over the counter, and see if your insurance is actually worth it in many places. We go through our reconciliation every day to see what we lose when we fill the prescriptions. What that doesn't tell us is what we lose on clawbacks. The reason the pharmacists at CVS and Kmart and Walmart don't tell you about them is they don't know about them. They don't know when they fill a prescription if they lose money or make money. They just fill the prescriptions. I'm not saying they're bad pharmacists. I'm not saying they're bad organizations. But when you get to be that large, the cost of a prescription means very little. They're just told to fill the prescriptions, and then somebody else reconciles that information. I was with Walgreens for 15 years. I managed stores in Colorado and Utah and California, and started out in Chicago. We didn't know. We didn't know, though, all those things. Even in California, our figures went to Burlingame at a regional level, and then they went to Chicago, where we were contacted 6 months after reconciliation. Many times we didn't know where we lost the money and how we lost the money. So as healthcare progresses, I asked my friend last night who sold to CVS in Sacramento, I said, why did you do it? He says, I just can't put up with it anymore. I can't put up with going to work, not knowing if we make any money. And for those of you who think that we make a ton of money, if it wasn't for this co-op that I'm in, most of the independent pharmacies would not make a penny, not make a dime from what the insurance company pays you. You've seen how many people are behind the counter. That's how many people it takes to run a pharmacy to get you in and out and take care of you. And it's quite expensive. So we're going to take a break. When we come back, we're going to take a break from the medication and talk a little bit about the wildfires that are polluting our air right now. Have you been to the pharmacy recently where the employees know your name when you walk in the door and have your prescription refill waiting? If you answer no, then you probably haven't been to one of the Northlake Medical Pharmacies. Hi, my name is Bill Kearney, owner of Northlake Medical Pharmacies. For 38 years, my wife Dana, our daughter Brandy, and our employees have been dedicated to giving you the best service we have when you come to get your prescriptions. We are a family-owned pharmacy, and our employees are members of the Northlake Medical Pharmacies family. We know you have a choice when you get your prescriptions filled, and we appreciate you making us your choice. You see, you are part of our family too. We truly care about your health and taking care of you when you aren't feeling well. We deliver your prescriptions free when we know ahead of time and do the best we can to take care of you and your family. Northlake Medical Pharmacies with 2 locations for you, on Hill Road across from Sutter Lakeside Hospital and 347 Lakeport Boulevard outside the Bruno Shop Smart in Lakeport.
This is the Caltrans Road Information Bulletin for Lake and Mendocino County State Highways for the week beginning Friday, October 13th. In Lake County on Route 29 near Coal Creek Road, weekdays expect 10-minute delays. Also on 175 near Arroyo Vista Road, weekdays expect 5-minute delays. In Mendocino County on Route 1 north of Crispin Road, weekdays expect 5-minute delays. On Route 20 near Little Lake Road, weekdays expect 5-minute delays. On Highway 101 from the Crawford Creek Bridge to just north of Confusion Hill, expect delays in multiple locations. Definitely some fire damage work down there. On 162 west of Pookanee, weekdays expect 10-minute delays. On 175 near the Lake County line, expect 10-minute delays. On 253 weekdays near Singley Cattle Pass, expect 15-minute delays. And on 271 at Piercy, there'll be a full closure. That'll detour onto 101. That wraps up the Caltrans Road Information Bulletin for Lake and Mendocino County State Highways. Like us on Facebook for more updates and info on the type of work we're doing. That's Caltrans, District 1.
Haunted Lake County presents It's a Surgeon Story. Friday and Saturday, October 27th and 28th. Doors open at 5 p.m. at the Lake County Fairgrounds. This year's maze will feature narrow hallways, new characters, and more automation. It's sure to bring you chills. Donations required as entry fee, with all proceeds going to help fire victims. For up-to-date info, visit Facebook at Haunted Lake County.
Raising your family, tending to your animals, growing your own produce, preparing for the seasons, living the country life. Hi, I'm Jody Henke, host of Living the Country Life. Catch me every Monday through Friday at 9:35 a.m. and 4:35 p.m. for ideas and inspiration for your place in the country. That's Living the Country Life here on AM 1270 and 96.5 FM KXBX.
We bring the community closer together, supporting business in every way. We're helping make your dreams come true, working hard for you.
The Lake County Chamber of Commerce would like to recognize their member of the month, Tom Lincoln from Lincoln Levitt Insurance Agency. Lincoln Levitt Insurance Agency insures hundreds of local and out-of-county businesses, providing such coverage as fire liability, business auto, workers' comp, umbrella liability, director and officer liability, and group benefits. It also provides a full line of insurance products to local farmers and agribusiness owners. To request an insurance review, Tom and his staff are located at 650 North Main Street in Lakeport. They can be contacted at 263-7162 or through the website at lincolnlevitt.com.
Lake County Chamber of Commerce, we're steady and strong, help us shape the future.
All right, Bill, we're back.
Well, we are. We were talking about Halloween and getting ready for Halloween, and Paul's got his place all decorated
Oh, yeah,
up and
spooky town.
got rid of all the ghosts, and you're ready to go.
Yeah.
So, well, I want to remind you again before we start out that Kmart is closing their pharmacy, if you don't already know, and you can come to our pharmacies and transfer your prescriptions. You don't have to go there to get a record of your prescriptions. We will do that for you. We still have free delivery if you let us know a day ahead of time, and we get out to most areas of the county except for the south end. We leave that up to the pharmacies down there that deliver. So be more than happy to take your prescriptions. Also remind you that we have a flu clinic on the 25th from 1 to 4. If you haven't got your flu shot before or you haven't come in, you don't have to wait for that clinic, but we'll have a pharmacist there in the afternoon from 1 to 4 to give flu shots, pneumonia shots, anything you need. A lot of people got the Prevnar 13 last year, and they still need to get the Pneumovax 23 or vice versa. So let us know. Come in. You don't have to make an appointment. You fill out one little sheet of paper, and we'll give you the immunizations. If you're on Medicare, they don't cost you anything. Most of your insurance, pay for the flu vaccine. Depends on the other vaccines and depends on your Medicare D. Some Medicare Ds pay for the shingles shot. Most of them do not. But if you need one, ask us. We'll run it for you and find out whether or not that occurs or not. And keep in mind that we have till the first part of the year to continue to give flu shots, pneumonia shots anytime. All the rest of the shots that you probably need, we can give you, and we'll be more than happy to do that. We're going through a traumatic time right now with the wildfires, and as well as the many people that have lost their homes, both in Lake County and Sonoma County and Napa County, and I think there are 5 counties, Butte, and you're all up for FEMA, so you can get extra money to pay for new construction, to take care of your insurance companies to take care of you and everything. But one of the things that we see and possibly doesn't have an effect until later is the lasting effects of the fire, and that's polluting the air. These wildfires burning in Napa, Sonoma, Solano Lake, and Butte has released more than 10,000 tons of particle matter. 2.5 refers to the inhalable particles with the diameter of 2.5 micrometers, about 30 times smaller than the average particle. 10,000 tons that have been released is nearly equivalent to the estimate of on-road vehicles in California for the entire year of 2014, which is the most recent year that we have. Nearly equivalent to the estimates of on-road vehicles in the whole state of California for the year of 2014. A comparison can be made about the quality of the air pollution in Beijing and the Bay Area. Beijing was 162 particle products of 2.5, and the Bay Area 1.58. On Tuesday, the Northern California wildfires led to the worst air pollution ever recorded in the area. The air score in Napa hit an ultimate high of 486, and that was 2 times the very unhealthy index for air quality. The lasting effects are going to show up different types of, or later, different types of air pollution can have different impacts on the body. My wife has a condition where she'll, if you tell her today at Rotary or whatever that I'm talking about her, I'm going to be in deep doo-doo. But just to show you an example, she has 40% capacity in one lung and 50% in the other. And those of you who know her knows that she doesn't mind very well. And I've asked her to wear a mask if she goes outside. She has not accomplished that feat yet, and she's now having trouble coughing a lot and already has had trouble breathing. She's applied for a BiPAP machine to force air into her lungs to get them to expand, because smoke or no smoke, that's a real problem that she has. But what I'm trying to explain to you is you go out there and you look and you don't think you have a problem with air particles, and they're out there. And they're very tiny, and you don't know that you feel them, that they're hindering you at all breathing, and then later on they're like little particles of glass in your lungs where you can't breathe. So that's important to note, that there's a lot of damage from the wildfire. In a recent study, they looked at hospital admissions for the elderly populations in the western United States, and they examined how wildfires impact the risk of anybody from 65 years and older. And it was quite significant. They found people were more likely to be hospitalized during and shortly after exposure to wildfire smoke. The researchers would not delve into the reasons for each hospitalization, but actual real-world people in the real-world population is difficult to get an accurate reading on. And the research shows that air pollution is detrimental to health in ways beyond those that immediately die from the wildfires. I don't know, Paul, if you heard the one about the people, the couple that was in a swimming pool.
Yeah.
And he survived being in the swimming pool, and she had respiratory problems and passed away in his arms.
Yeah, I did hear that. I think actually there were 2 couples that went into swimming pools, and one of them both survived, and the other one, the woman had died from smoke inhalation, I think, yeah.
And that's just how lethal this can be. In other words, the health consequences from this smoke will be much larger than we see right now. Females are more vulnerable, as Paul just said, to wildfire smoke than males. We don't know why. Children are more at risk than adults. Generally, air pollution is very harmful to infants. And I think about those animals at the Safari West, where the owner saved all those animals, and these these animals inhaled all this smoke, and I'm just wondering if later on that there's going to be some sort of penalty for them inhaling all that smoke. Exposure in the womb to air pollution in general can lead to preterm birth and birth defects. The wildfire smoke would have an impact on infants. To protect themselves, people need to reduce their exposure to the wildfire smoke, and in extreme cases, maybe evacuation. We've gone through that, perhaps, but California ranks high among states with the most polluted cities to start with. The State of Air report from the American Lung Association found that the state had 7 of the 10 most populated metro areas in the country. Clearly, the wildfires with blazes that have scorched more than 200,000 acres and almost 5,000 structures. This week's fire is the deadliest in California's history, and they will likely be part of California's future due to the changing climate, which it's extremely difficult to link individual incident to climate change, but the wildfires are one way in which the climate change is going to affect the health of people. We have people coming in all the time wanting masks. All that we can get for masks are the ones that are like surgical masks or for asthma and those kind of things. They don't have a control. All of the more structured masks that do a better job of getting the filtrate out have been purchased by the Red Cross and the physicians that are taking care of all the people that are hurting from air inhalation of the smoke. So everything that we have tried is out all across the nation, sending everything to California. So sorry that we do have masks for sale, and one of the physicians told us we were giving masks out. Unfortunately, because of the cost of them, we can't do that. We're trying to get some in the bulk so we can just charge $1 to get them out. But these health problems are going to continue to exist, and I'm sure that you have tried every place you can to get something like that. Wherever you can get a mask, that's what you should do. And most of ours come in boxes of 6 or 8 or whatever they are, because they don't last very long. But if you're somebody that's suffering from respiratory distress, I know you're using your inhalers more than you should. Some of those inhalers you can't use more than once or twice a day. If you haven't, you need to get a rescue inhaler from your physician. And we are still operating under the State of California wildfires amendments to take care of you. If you can't get to your doctor and you need your prescription refilled, we're allowed to fill that prescription. If it's a controlled substance, we need to verify that. It won't be able to be filled early unless we can have a document that says you actually lost it in the fire from an official. But we can give you a 2 or 3 day supply to get you by. If it's an inhalant or something like that, we'll be able to help you if you have a prescription for it, and we can verify that through the physician's office. Many physicians in Sonoma County lost their homes, as well as some in Lake County. So we understand that, and we'll do everything we can to make it easier for you. That is not one of the more prevalent things that we thought we'd be addressing right now, but we are. We have a list of, to lighten things up a little bit, some common medications that could be blamed for your weight gain. Now, I don't want you to take, because I'll tell you, I'm taking half of these medications, and I'm not gaining weight, but I've always fought my weight, and I continue to fight it. One of the things that I'm not taking is an oral contraceptive. And sure, you're expected to gain weight if you're expecting, but putting on the pounds for not trying to get pregnant, all birth control meds release the hormone progesterone, and progesterone can give you the munchies. Excuse me. Besides increasing your appetite, they can cause water retention and some what we call belly bloat. So the good news is most modern-day birth control pills use a lower mix of hormones than the older ones. When we first started giving out birth control pills or dispensing birth control pills in the 60s, they were in the 10 milligrams. Now they're in micrograms. The biggest weight offender may be Depo-Provera, which is a contraceptive shot and makes your period disappear, but studies show that many women, it makes pounds appear instead. So like so many things in healthcare, we can't tell you that that's the reason you're gaining weight, and even if they tell you you're not going to gain weight, sometimes you don't gain weight, and sometimes you lose weight. So you can ask your physician about an IUD or hormone-free options. The next thing is something that I do take, and that's beta blockers. And tenormin or altenolol is one of those. Metoprolol is another one. Propranolol, which is Inderal, is another one. High blood pressure or hypertension puts you at risk anyway, from kidney failure to a heart attack, so a little spare tire doesn't seem too much by comparison. But you want to minimize that as much as possible. Older beta blockers that are given to lower blood pressure, including tenormin, Lopressor, Inderal, Metoprolol, have a tendency to cause extra pounds to creep on, just by the nature of what the drug does. Lowering the heart rate, also lowering your metabolic rate. And if your metabolic rate is going to go down, you're going to be burning fewer calories, and you may need to take precautions not to gain weight. Okay, what do you do? I mean, I've been taking this drug for 30 years, and it's effective. And I've been able to lose weight by taking it, and I haven't really blamed it. I think you go back to the old adage, if you burn off less calories than you take in, you're going to gain weight. Part of that may be that you're taking a beta blocker. But if you've been on it as long as I have, you've learned ways to try to keep it off. Right now I have 3 broken ribs. Am I swimming every day? No. Am I exercising every day? No. Am I gaining weight? No, but I'm trying to watch what I eat. ACE inhibitors may be, or a calcium channel blocker may be something that have less of a weight gain effect. And keeping your diet in check when you're taking these medications may help. Again, that doesn't mean this is going to affect you. It's just a possible thing. Insulin, more than 1 in every 10 adults over the age of 20 has diabetes. That number goes 1 in 4 for adults over the age of 65. Diabetes 1 and 2 are usually treated with insulin or some insulin drugs that help produce more insulin. While the whole principle of taking it is to reduce sugars in the bloodstream and get them back in the tissues where they can do their job, many people with diabetes are already overweight, and that's why they're overweight. Particularly those with type 2. Those are lifestyle choices, and that usually doesn't come on until later on in your life, and they usually reflect a lack of activity to burn off caloric intake. So they're already set up for weight gain. And I'll add something else to this. People who were addicted to opiates and were taking opiates for chronic pain, really real pain, are not being able to get those opiates anymore, and they're hurting. I just gave an immunization yesterday to a gentleman I've known for years and years, and he's got bad back shoulders, bad knees, just about everything you can, and hurts all the time. And he's not gaining weight, but he's not been one that would gain weight normally anyway. He's been a very active person. But that's another thing that adds to it. I mean, when you hurt all the time, you don't feel like exercising. You can discuss an exercise program with your doctor. Even walking as little as 30 minutes a day can be effective. Diabetes prevention programs up your physical activity and can even reduce the risk of developing type 2 diabetes by 50%. So as we've said many times, a healthy diet is the key. Here's another drug that many, many people take, and the 2010 Journal of Obesity found that men and women taking antihistamines, such as Allegra and Zyrtec, weighed an average of 9.5 pounds and 4.4 pounds more, respectively, than people not taking those drugs. It seems that blocking the histamine can stimulate appetite. Again, that doesn't mean it's doing that, but that's only if you're on an antihistamine for the long haul. If you're taking an antihistamine on an as-needed basis for hay fever, for example, then any weight gain should only be temporary. But staying on it for long term isn't a good option for most people. That has changed a lot since the new advent of the first and second generation antihistamines, where the non-sedating ones, Zyrtec is one of those, Allegra is one of those. The alternatives may be a trial and error situation where you talk to your physician about which drug may be the best for you. Maybe it's a nasal spray, which has more localized effects, and you can take a break from antihistamines. This next one is one that I think we're all aware of, and that is steroids. Gardening in the in the yard, and you end up with poison oak. Maybe steroids may be your new best friend when it comes to those red welts. That's because they fight inflammation, and not only are they for inflammation externally, they're for inflammation in the lungs also. So many steroids are needed long term for cases of arthritis treatment, asthma, gastrointestinal, respiratory symptoms. We know they can gain weight, they can cause weight gain and possibly water retention. The way that cortisone in our natural body system works, it also increases our appetite. When I was on steroids for poison oak for a period of about 6 weeks, I was hungry all the time. I ate all the time. I wasn't, my anxiety level was such that I would hate to think if I was on it for a long period of time, because I gain weight pretty easily. The last one is one you may know and may be a problem, and it may not be, and that's antidepressants. On top of the depression, people who are depressed are 58% greater risk of becoming obese. Some 1 in 6 adults in the United States have been prescribed antidepressants, end up suffering from side effects such as weight gain. They're supposed to make you feel better. Much as 10 to 15% of the population is prone to gain weight from these medications. Again, that doesn't mean you've gained weight from them, but it's a possibility. And if you take some of these drugs and you take more than one, the chances are it's a little overwhelming. The side effects on these drugs vary from person to person. Even the drug packaging indicates that it may cause decreased and increased weight gain. For example, some of the drugs that came out in the very beginning as an antidepressant, the first thing they tell you is that you may lose weight from it because it makes you feel like you're full, and where some of the others may cause the serotonin and dopamine in those drugs are neurotransmitters associated with pleasure, and guess what makes you happy many times? It's possibly eating more. So Prozac is the one that first came out, that we have alerted people that it may allow you to lose weight rather than gain weight. Obesity among adults and youth in the United States from 2015 to 16, there was a prevalence of obesity was 39.8 and in adults and 18.5 in youth. Was higher among middle-aged adults and younger adults, was higher among youth from 6 to 11 years old and 12 to 19 years old, was higher among non-Hispanic, black and Hispanic adults. The observed change in prevalence between 2013-14 and 2015-16 was not significant. Men and women had a similar pattern. about 40.8 to 44.7. There was no significance in the prevalence of obesity overall by age group. There was, it seems like women have a more difficult time losing the weight. Whether they are easier to gain the weight, I'm not sure. But it's one of those things that has become an epidemic proportions in this country, and now especially in children. And we look at the activity level that kids have today compared to when we grew up, which was a little bit after the stagecoach and wagon wheel days, and we were directly involved in exercise, just helping around the farm or the house, collecting wood, being outside, playing. A lot of things that people in the inner cities now can't seem to do because of the risk of something going on and not being safe. So we just want you to know that obesity is a huge problem, and we want to do everything we can to control it. I want to remind you again that our flu clinic, you can get a flu shot any day that you want, any shot that we possess other than yellow fever. We'll be happy to give you. But there is a clinic on October 25th on a Wednesday, right after our radio show from 1 to 4 o'clock in the afternoon. Diane is going to be giving flu shots, so you don't. I had a lady come in yesterday, and our protocol physician is Dr. Romero out of the state of Washington. And these two ladies, I think, were sisters, and they came in and they said, "Where's the lady? I thought Dr. Elizabeth Romero, I thought she was giving the shots." And I said, "No, she's the protocol physician that allows pharmacists to prescribe and dispense the medications." And they were quite shocked that this old man was standing there giving them a shot, so I made it so it didn't hurt. But October 25th from 1 to 4. Remember, if you're having to leave Kmart, that we're available to fill your prescriptions. You do not have to go to CVS. We can do all the transferring for you. Remember Medicare D. Medicare D, don't rush in right now because plans are still changing. You have until December the 7th to change your Medicare D plan. We are researching those plans right now. Yesterday was the first day. I'm going in tomorrow and to my other store with my daughter, and we're going to go through plans up there and see what's available for you. So remember, we're North Lake Medical Pharmacies with 2 locations for you at 5136 Hill Road East across from Sutter Lakeside Hospital. Call us there at 263-6192. And outside the Bruno Shop Smart at 347 Lakeport Boulevard, give us a call there at 263-1328. Thank you, Paul.
Thanks, Bill. See everybody back here again next Wednesday at 10 a.m. for Health Talk on AM 1270 and 96.5 FM, KXBX Lakeport.